doubts. It says, is it okay that she's having doubts? Then I'd be kind of worried if you're not having doubts, because I think that's very normal when approaching such a large surgery. I don't know, Chandler, did you have doubts?
Definitely. I think, like like Dr. Standard just said, I mean, it's definitely very emotional, and I feel like there's definitely your good days, but that doesn't mean it's going to be all good days. Like, there are going to be your bad days, and there might be, like, I mean, I did have days where I just told myself, I was like, I can't believe I did this. Like, why did I do it? But then, like, 5 minutes later, I'm like, I'm going to get through this, and it's going to be awesome. And, like, I honestly tell everybody, it's just, for me, it was totally worth it. Like, I am, like, so happy with how everything turned out. And, it wasn't easy, though. I've had 2 leg lengthening procedures, and they definitely, like, both were not completely easy, and there were bad days, and there were times where I was like, maybe we need to just stop, like, not do the full lengthening and just stop halfway or something. But I mean, I think it just kind of depends on the person, and I think, each person's different, but, I think everybody will sort of get, like, what they want to happen.
Yeah, I agree. And goals can change as the time goes on, but I do think it's definitely something that you can't jump into very quickly without doing your due diligence, getting your family support, setting up your life, and especially if someone asks me what's the goal of limb lengthening and bone dysplasia, and I first, because I've been asked multiple times, is this a cosmetic surgery? And are you saying every patient with bone dysplasia should go through this? And I think first it's a very personal decision, and I do not advocate that every patient with bone dysplasia, whether it's with or without deformities or with or without short stature, trunk, or lower limb stature issues, should undergo lengthening. I think it's a very personal thing, and I think it shouldn't be dictated by doctors, and it also shouldn't be mandated or pontificated by doctors that this has to happen. But I think if you ask me in my heart, what do I change the most? I think probably 3 things, and one, there is a functional height in society as far as just basic utilities and basic size of things, chairs, desks, cars. And usually if you are between the height of 4'10" and 5 foot, or even 5'2", in that range, then all those things are accessible. I think the second thing is the humeral lengthening, I believe is huge for functional distance and self-care and self-needs, especially as time goes on. And we all get stiffer as I've gotten older. You don't touch your toes as well and reach places that you need to reach. And so the humeral lengthening is a pretty amazing and functional improvement. I consider the lengthening and the limb alignment extremely important. The limb alignment even more so to prevent early onset degenerative disease or arthritis. The lengthening to really improve functional abilities. And so it's not a cosmetic surgery. It's a very functional surgery that has positive cosmetic side effects. Some surgeries have negative cosmetic side effects, but this is one that has a positive cosmetic side effect. It's not the main issue, and it's not the main goal, but it is there. And I think some of the things that my patients have told me have really kind of made a difference over the years after a lengthening or an arm lengthening, what they could accomplish when they couldn't before. And those kind of things, for that person, it was the right choice. So if we move on, and I'm sorry, I don't want to talk too long. We'll go to question number 2.